Hello, and thank you for taking the time to complete the 2020-2021 Occupational Safety COVID-19 Employee Training. Today's training is fairly straightforward. First, we will complete this video review of the safety guidelines. Then we will independently read the corresponding safety guidelines document. And lastly, all employees are expected to submit an acknowledgement form by the end of the day today. While we all have been affected by and learning about COVID-19 here in 2020, the purpose of this training is to ensure we have a shared understanding of COVID-19 and how we are all expected to be responsible for ourselves and each other given these current circumstances. So we'll start with a basic definition of COVID-19. The coronavirus, or COVID-19, is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world, and COVID-19 symptoms can range from mild or no symptoms to severe illness. Infection may occur from coming into close contact, which is about 6 feet or 2 arm lengths for more than 15 minutes, with a person who has COVID-19. COVID-19 is primarily spread from person to person. Infection may occur from respiratory droplets when an infected person coughs, sneezes, or talks. Infection may occur from touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes. There is currently no vaccine to protect against COVID-19, but the best way to protect yourself is to avoid exposure to the virus that causes COVID-19. Everyone is at risk of getting COVID-19, and older adults and people of any age who have serious underlying medical conditions may be at higher risk for more severe illness. So, for the safety of all employees and students, all staff members are required to follow the following protocols. So, first, screening and entering the building. Employees are required to check their own temperature before coming to the office each day. If you have a fever of 100.4 degrees Fahrenheit or greater, you may not enter the workplace. Employees are required to stay home if they are experiencing any of the following symptoms in a way that is not normal to you: congestion or runny nose, cough, diarrhea, fatigue, fever, headache, muscle or body aches, nausea or vomiting, new loss of taste or smell, shortness of breath or difficulty breathing, or sore throat. Employees must complete the wellness screening on Skyward Employee Access via either the website or the Skyward app every day before arriving at the building. If you answer no to both questions of the wellness screening, you may come to work. If you answer yes to one or both of the screening questions, you must inform your administrator and stay home until cleared by your healthcare provider. Employees must enter the main door of each building and conduct a temperature screening each day. Thermal scanners will be the primary method of temperature screening, but in the cases when the device is unavailable or in need of maintenance, these daily temperature screenings will be conducted in the main office via handheld contactless thermometers. The district may also conduct mid-shift screening to verify no presence of COVID-19 symptoms. In person will be preferred, though virtually is permitted. Employees must wear a face covering or mask when entering the building. Employees shall apply hand sanitizer when entering the building, and employees must go directly to your work area to minimize movement within the building. With regards to hygiene, the district will provide hand washing capability or sanitizer to employees and visitors. Frequent hand washing by employees is encouraged, and an adequate supply of soap, paper towels, and/or disinfectant hand sanitizer will be available. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick with respiratory symptoms. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And if you have not already done so, discuss influenza vaccination with your healthcare provider to help protect you against seasonal influenza. Please maintain social distancing of at least 6 feet, which is about 2 arm lengths, as much as possible. Keeping space between you and others is one of the best tools to avoiding exposure to the virus. And again, please stay home when you are sick. Personal protective equipment, or PPE. Public health guidance indicates that wearing a cloth mask prevents the spread of respiratory droplets. Employees must wear coverings over their nose and mouth when within 6 feet of others. And again, cloth masks are preferred. Employees must wear a mask in all public areas: restrooms, common areas, conference rooms, copy rooms, in the hallways, etc. Removing your mask temporarily is permitted when eating, when you're outdoors and physical distancing of 6 feet can be maintained, playing a musical instrument with at least 6 feet of social distancing, using a face shield temporarily for instructional purposes while social distancing of 6 feet can be maintained. Again, removing your mask temporarily is also permitted for teachers needing to show facial expressions where it is important for students to see how a teacher pronounces words. For example, English learners, early childhood, foreign language, etc. However, teachers will be required to resume wearing face coverings as soon as possible. Preferred alternatives to teachers wearing face shields include clear face coverings or video instruction. There must be strict adherence to social distancing when a face shield is utilized. The district will provide employees with reusable face masks and face shields, but employees may also choose to wear their own work-appropriate mask. If an employee does not have access to a mask, he or she should notify the supervisor immediately. Fit-tested N95 respirators, eye protection, gowns, and gloves will also be provided to employees who are treating students with COVID-19 symptoms or who are cleaning areas occupied by an employee or student with a confirmed COVID-19 case. Cleaning and disinfecting common areas, such as restrooms, doorknobs, etc., and surfaces which are touched by multiple people, such as entry and exit doorknobs and stair railings, will be conducted frequently, at least every 2 hours as recommended for high traffic areas. Cleaning and disinfecting of premises will be conducted in compliance with CDC protocols and with EPA-approved products on a bi-weekly basis. The district will utilize electrostatic disinfectant sprayers at each building as part of this bi-weekly disinfecting process. Workstations are expected to be disinfected by employees upon arrival and before leaving for each day, or for the day, with cleaning products provided by the district. Please keep your work area, student desks, and other classroom surfaces and walls free of paper and clutter as much as possible to assist in the cleaning process. Here's what to do if you are sick or have symptoms of COVID-19. Symptoms of COVID-19 can include the following. Again, congestion or runny nose, cough, diarrhea, fatigue, fever, headache, muscle or body aches, nausea or vomiting, new loss of taste or smell, shortness of breath or difficulty breathing, or sore throat. If you are experiencing any of these symptoms, again, please stay at home. Symptoms can range from mild to severe illness and appear 2 to 14 days after you are exposed to the virus that causes COVID-19. Please seek medical care immediately if someone in the building is exhibiting the early warning signs of COVID-19, which can include the following: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. If an employee tests positive for COVID-19, they should remain isolated at home for a minimum of 10 days after symptom onset and may only return after being feverless, without a fever-reducing medication, for at least 24 hours and symptoms have improved. The district also requires that the employee furnish a negative test result before returning to work. If an employee tests positive for COVID-19, cleaning and disinfecting will be performed after the room has been closed off for at least 24 hours per the CDC guidelines. The district will notify families, teachers, and support staff while maintaining confidentiality as required by the Americans with Disabilities Act and the Family Educational Rights and Privacy Act. Any employee who has had close contact, which is defined as within 6 feet for 15 minutes or more, with the infected coworker or any other person who is diagnosed with COVID-19 must quarantine for 14 days after the last or most recent contact with the infectious individual and should seek a COVID-19 test at a state or local government testing center, healthcare center, or other testing location. All other employees are asked to monitor themselves for fever, cough, or shortness of breath and other symptoms, and taking temperature if symptoms do develop. This is an example that is also provided in the document as an attachment of the IDPH's COVID-19 exclusion guidance. So here you can see across the top multiple scenarios, either with positive COVID-19 test results or suspected symptoms or other illness here. And you can see the workflow of what the responses will be in these various scenarios. So please take some time to review this flow chart and ask your administrator or the business office if you have any questions about how these scenarios will be responded to. Now we have a few other guidelines with regards to our district responses and another best practices we will be implementing. First, with regards to facilities, the district has installed higher MERV rated air filters, MERV 13 rated, per the American Society of Heating, Refrigerating, and Air Conditioning Engineers guidelines. The district will also institute an accelerated air filter replacement cycle, ensuring replacement at double the recommended schedule. Transaction counter screens and office dividers have been installed in school offices to reduce physical contact and potential exposure. Water fountains, except for touchless water bottle refill stations, are unavailable for use. And vending machines may remain in use but will be expected to be sanitized after each use. Disinfectant wipes and hand sanitizer will be placed next to the machine for employee use. Other working conditions include the following. If practical, avoid sitting closely or facing each other. Employees should remove personal items from the workplace and classroom to allow for easier cleaning. Reduce the use of shared papers and supplies and use digital tools as much as possible. If practical, please use phone or video conferencing while at your desk instead of meeting in person. If an in-person meeting is necessary, limit it to 10 people with social distancing. And lastly, the Illinois Department of Public Health recommends avoiding travel to areas of higher risk, which you can find here in this link or on the IDPH website. If you do travel to areas of higher risk, contact your administrator. Depending on the circumstances of your travel, you may be required to stay home after returning to monitor your health for 14 days in order to protect the health and safety of yourself as well as others. And visitors will be scheduled by appointment and met with via virtual meeting or phone call if possible. External suppliers will be asked to drop off deliveries in a contactless fashion if possible. Before allowing an external supplier or visitor to enter, or while requiring them to wait in a designated area, the district will ask whether the external supplier or visitor is currently exhibiting COVID-19 symptoms. The district is permitted to take the external supplier or visitor's temperature. Buildings will keep a log of all external suppliers and any visitors who enter the office. And suppliers and visitors will wear face coverings over their nose and mouth when entering the premises. So our next steps here after completing this video training is to read the corresponding occupational safety COVID-19 training for employees document and complete the acknowledgement form, which is linked to a Google form, which is very brief, and that is required by the end of the day today. And please submit any questions or feedback that you have in the acknowledgement form directly or by contacting the business office at 630-260-6109 or emailing at fiscalservices@queenbee16.org. Thank you very much.